Hello everyone. This presentation is on CALE, also called frigid extremities powder. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, CALE belongs to the category harmonize. A representative pattern is liver-spleen disharmony with cold hands or feet, rib side discomfort, and emotional constraint. Important ingredients include chai hu, bai shao, jai shi, gan kao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 41-year-old woman with stress-related digestive tension and cold extremities. The current medicines are sertraline, hydrochlorothiazide, aspirin 81 mg. This case gives a possible reason to consider CALE, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is gan kao plus hydrochlorothiazide. The mechanism is that licorice can worsen hypokalemia and raise blood pressure. The clinical significance is moderate. My management plan is monitor electrolytes and blood pressure in longer courses. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is bai shao plus aspirin. The mechanism is that peony has mild antiplatelet signals in some sources, so additive bleeding is theoretically possible. The clinical significance is probably low, but still worth noting with daily aspirin. My management plan is ask about bruising and avoid layering multiple blood-thinning supplements. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is jai shi plus sensitive medications. The mechanism is that citrus-related constituents may affect GI motility and possibly transporter activity. The clinical significance is usually low. My management plan is use conservative dosing when multiple medicines are taken. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, CALE may be reasonable when the patient truly matches the pattern liver-spleen disharmony with cold hands or feet, rib side discomfort, and emotional constraint. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.